Thank you for allowing me this time to present at your town council meeting. What is a community profile inventory? Hi, my name is Susan Fleming. I'm a registered nurse at Johns Hopkins Hospital, and I'll be talking to you about your town of Mount Airy, Maryland. Nurses use the nursing process. We collect and evaluate information in order to determine healthcare needs. We do this through an assessment. So I assessed your town of Mount Airy, and I'd like to share with you my findings. I performed a windshield survey. What this means is that I went through your town, drove around, looked at the town as a place. I did some research on its population and also the social system. Came up with a strategic plan that was based on 3 prioritized diagnoses for the town based on what I felt was deficient, and then I came up with some interventions that I'll share with you. The strategic plan that I came up with is aimed at areas of concern that I found from the assessment I did on your town. I used Healthy People 2020 topics and goals for improvement of the community. This Healthy People 2020 is a 10-year national objective for improving the health of all Americans. Now I'd like to talk to you about your community as a place. Mount Airy is equally located between Frederick and Carroll counties in the state of Maryland. It borders 4 counties, Carroll, Frederick, Howard, and Montgomery, and you can see that here in this slide. The zip code identification for Mount Airy is 21771. The town was established in 1894. The town's place comprises health services to include 2 major healthcare facilities. They're easily accessible from the town. They are known as Frederick Memorial Hospital and Carroll Hospital Center. Available within the town are many health services that function to assist the needs of the community. I've listed a few of them here on this slide. Other healthcare facilities in Mount Airy include 230 family physician offices. Environmental statistics include 1 supercenter, 31 convenience stores, and 95 restaurants. Yes, 95. 17 gas stations, 20 grocery stores. As you see, Mount Airy is full of conveniences and many resources that make life less fragmented and easier to live for the people of Mount Airy. This is an example of how conveniences and resources provide a non-fragmented, continuous, and comprehensive care. Some geographic features of Mount Airy are your rolling hills. There's plenty of hiking trails. You'll see fertile farmlands. The farms in Mount Airy provide fresh vegetables and fruits for the residents, and then the trails promote physical activities to improve health. These next 4 slides talk about climate, and in the town of Mount Airy you'll see that the one with snowfall is actually a little greater than the U.S. average. They have harsh winters starting in December until the middle of March. This could present a problem for people who have cardiovascular disease. If they're out shoveling, so you always worry about the risk of an incident happening, or harsh road conditions can be attributed to car accidents. But generally, the temperature in Mount Airy is a temperate climate, and it's good for agricultural production and physically less strenuous on the population as compared to other states. When performing a community health assessment, you want to take a look at the environment as a variable. Healthy People 2020 has an objective for this topic area known as environmental health. The goal is to promote health for all through a healthy environment. Overall, Mount Airy is doing a really good job. They're equally comprised of Mount Airy and Carroll counties, of which both of those counties ranked high in the 2014 County Health Rankings and Roadmaps, which is a Robert Wood Johnson Foundation program. Now, they did have some problem areas as far as the subcategories of pollution, driving alone to work, and long commute driving, those needing improvement. But overall, they ranked high, Frederick being 3 out of 24, and Carroll County 4 out of 24. We'll talk a little bit further about the transportation issues later on in the slideshow presentation. So I told you in the beginning in my introduction that I drove around the area and did a windshield survey. I know that you all know what your town looks like, but I didn't. And this is ever so important when you're performing a community assessment, because you're making plans and coming up with some strategies and some interventions. And how is it possible if you don't even know what the town looks like? So just real quick, the characterization of the population is as follows. I noticed that Mount Airy has a lot of infrastructure that's very beautiful. It's both modern and old. The overall look of the community is a mix. There's some very rich neighborhoods and some poor, dilapidated ones. You've got trailer parks, industrial parks, automobile junkyards, train tracks on the west side. And then further east, you have more upscale homes and new businesses. And then in the center of town, there's your Main Street. And Main Street has its winding, narrow, two-way, congested roads that aren't very well lit. There's uneven, non-connected sidewalks. I also noticed that there's many antique stores. You have several churches, recreational parks. Again, I mentioned that there's gas stations and car dealerships. There's a lot of open ground on the outskirts, large lots with homes and farms scattered out on the outskirts, like I said. The schools are nicely kept with playgrounds. There's tightly condensed, connected neighborhoods in town. Many restaurants and businesses galore. But one thing that I did notice is that the town itself appears to be very booming. There were people out shopping, just roaming the streets, in town. You could see a lot of automobiles whizzing around, children playing, many bicyclists. There were people out walking their pets. It's a fairly clean, non-polluted looking town. You can tell that revitalization is taking place, but there's a really good sense of community. I felt safe. I noticed that there's the Maryland and American flags hanging, some strong football-minded people who live here. They like the Ravens, the Steelers, the Redskins. It's just the community is very, very community-oriented. I felt the culture of the community was good. Now that I've identified your community as a place, I'll share with you the identity of the people in your community. I'll touch on the variables on this slide, and these variables influence the state of the community's health. This slide gives you some people quick facts. As you can see, the population in 2012, just an estimate, for Mount Airy was 9,340. The size of the town is manageable in terms of if there were an outbreak to occur. The surveillance and tracking of the communicable disease would be certainly easier to accomplish than a larger city or a larger size population as compared to, say, the whole state of Maryland. The United States Census Bureau statistical data defines that the town is densely populated as compared to the state. So Mount Airy has 2,255.5 persons per square mile with an expansion of 4.12 land area in square miles. Now the state, if you look at it, they have 594.8 persons per square mile in a 9,707.24 area in square miles. This was in 2010. So as you can see from the statistics, Mount Airy is densely populated. And with that dense population comes an increased stress on individuals and communities. For example, the environmental pollutants like secondhand smoke from tobacco users, emissions of gases from car exhaust. These both can cause an increase in respiratory and cardiac disease. Healthy People 2020 has the topic area of environmental quality. Two of the objectives under that topic area are the air quality index, and then secondly is the environmental quality. So Maryland has met, I didn't say Mount Airy, I said Maryland, has met those objectives. People in the community of Mount Airy is a young community, making that met target appropriate for the town because it is young, and you don't want the secondhand smoke to inflict your young population. Now, on the flip side of that high-density area, you have an abundance of readily available healthcare services. And since this area is noted to be urban cluster, chances are lessened for increased crime, disease, and or unsafe housing. When determining healthcare needs of a community, you need to really look at the makeup of the demographics. Some of the variables you might want to consider are the age, the sex, the race, marital status, occupations held in the community. These are just a few. But digging in deep and looking closely can give you a better picture of what's going on in your community. This community, Mount Airy, the ethnicity makeup is predominantly white at 89%. As you can see, there's very little Hispanics, Asians, American Indian, Alaskan Native. But if there were, these other groups or other races have certain predominant diseases, which you would really want to look at so that you can provide maybe some education or outreach programs to better serve your community. Literature suggests that marriage may have a wide range of benefits that include improvements in individuals' economic well-being, mental and physical health, and the well-being of their children. As you can see from this slide, the town of Mount Airy has 60.6% that are married, which is indicative of healthy relationships, which is good for the health of the community. This slide depicts the demographic profile of the community. As you can see, 10% of your people are 10 to 14-year-olds, 9.9% are 40 to 44-year-olds, 9.8% are 45 to 49-year-olds, and then 9.5% are 5 to 9-year-olds. So, relatively speaking, the community is young. This correlates with the recent growth that the town has seen in the past 2 decades. But with this growth, from a health standpoint, you need to consider, is there emergency services? You need to address public safety issues. Are there enough public schools? What about parks and recreation? Are there enough libraries and senior centers, government facilities? What about solid waste and recycling? What about the water? Is the sewer sufficient? How about the wastewater? All of these are important variables to look at when you're looking at the community's health. This slide lists the most common occupations. As you can see, 9.5% are computer specialists, and then it lists a slew of other occupations in the community. The reason that you want to look at the occupations is because with that comes certain health ailments. For example, truck drivers who may have chronic back pain, or these computer specialists who might end up needing eye care. Or do we have resources set up in the community to serve these people with these occupations that may cause an increase in certain health conditions? Another one might be sales representatives with increased stress leading to tobacco use and obesity, farmers and groundskeepers with major and minor work-related injuries. All of this plays into looking at the community as a whole and determining what sort of resources we need and do we have them. One way to determine population stability is to look at vital statistics and measurement of the town's birth rate. As you can see in this slide, Mount Airy's growth rate from migration, not from birth, has slowed down from 2010 to 2012 at 0.6% compared to 2000 and 2010, which has a documented 44% growth rate. The town's growth is declining. For a better word, it's becoming stagnant. This has been self-perpetuating slowing down of growth because of the restrictions put in place due to decreased water availability and sewer capacity. Again, these are the things that you need to look at when you assess a community, because this is a potential health problem. The town of Mount Airy has recognized it and have put some regulations in place to prevent there from any problems regarding the sewer and no water availability. Death by percentage of population is another area that you can look into to determine a town's stability. I used the CDC Wonder from 1999 to 2010 that helped me determine the death rate during that time frame, so I know what people were dying from and how I may improve those statistics. 2,841 deaths out of 400,514 out of the total population. That's not bad, and it was found that the age group, if you were looking at the 10-year brackets, 85-plus-year-olds were the highest group for death. That's very consistent and expected for that age group. There really weren't any extreme elevations in death of any other age group. And I found that the two leading causes of death in the two counties of Frederick and Carroll were malignant neoplasms and diseases of the heart. This is pertinent information because as a nurse, we can guide the community to help lower those statistics, improve through education, through health promotion, disease prevention. That's why it's ever so important to gather up these variables and really do a collection of data and then evaluate that data so that you can come up with a plan. Just as we looked at death, we also need to look at life expectancy. After I did my research, I found some areas of concern in Frederick County for the year of 2012. There was a rise in infant mortality for whites and non-white Hispanics, greater than the Maryland's average. There were also issues with the neonatal mortality rate, also higher than Maryland state, and post-neonatal mortality rate was not presented because it was less than 5 events compared to the state's 1.6. What does this tell us? This data tells us that we need to beef up our prenatal education. We need to reach out to those pregnant women. We need to promote their health by providing them with support, resources, whatever it takes to have them meet the objectives set by Healthy People 2020. The last variable I'm going to speak on is the growth rate. Again, I'm going to touch on some housing quick facts. As you see from this slide, in 2012, people that lived in the same house 1 year and over was a high percentage of 94.3. Housing units in 2010 were 3,225. Home ownership rate was 82.3%, and housing units in the multi-unit structure during 2008 and 2012 was 9.3%. These are some good statistics. It shows that there's stability in the town. The shift in the growth rate, again, that we see, or that was identified through the statistics, was due to the water availability and the sewer capacity. The town operates off of a group water wells. So in the town's strategic plan that's currently permitted for 1.2 million gallons per day of processing, and anything beyond that will require a new treatment plant. You all know that. I'm finding this out. The problem is the financial burden, as can be seen in the comprehensive strategic plan. So the town will need a new ground well if major development were to continue to take place. Presently, there's regulations, and you saw on the chart that I showed a few slides back how the growth rate was really elevated at 44%, and then it tapered off to 0.6% change in that growth rate. Lastly, we want to identify the community as a social system. Availability and accessibility of adequate facilities like recreational, educational, and daycare services, provisions of transportation and safety, and adequate healthcare services and providers, those make up a social system. These interacting parts that you see on this slide help to comprise a social system. Those are the subsystems that have establishments with participants. Mount Airy surpassed the state of Maryland for bachelor's degree and was underscored for doctorate and professional school degrees, as can be seen in this slide. What we know is that the higher education you have, the more likelihood of a higher occupational level, therefore higher income. And what does that mean overall? The social determinant of health, according to Healthy People 2020, identified that this relationship between these factors make it so that you're going to have a good health, you're going to function well, and your quality of life outcomes will be good. Mount Airy does not share health literacy. Residents of the community have graduated high school. According to this chart, you can see that they've surpassed the state of Maryland's average of grades 9 to 12. Mount Airy residents are educated, as determined by the last U.S. Census survey. 1,071 people in Mount Airy had a bachelor's degree or higher, which represents 29% of the total population. The national average is 24%. 3,335 people in the community had a high school degree, or 90.3% of the population. One thing to consider when you're talking about education is literacy. There was no identified area of poor literacy in the community, and we based this on residents that did not graduate high school. I just told you that Mount Airy had a high graduate rate. Second determinant of literacy would be people who do not speak English before starting school. There were 322 people in Mount Airy who spoke a language other than English at home. This represented 5.7% of the total population, as compared to the national average of 17.9%. So that's really not a problem. And also age 65 plus years and older, which indicates that Mount Airy has 8.3% of the total population. That's 65 years of age and older. And then the last variable is the black population. 2% of Mount Airy's race is African American. Mount Airy's data related to these characterizations suggest that they're less likely to be below the health literacy level. Adequate recreational settings are important in improving health by increasing physical activity. We know that getting out there and being physically active is good to reduce obesity, improve your overall general health, your psychological health. The town parks in Mount Airy are present, and there's many with a lot of acreage. However, it's just not enough that meets the population rate of growth. And in the comprehensive strategic plan, your town's people have asked that there be passive and active recreation, and you all have identified that this is an area of not really concern, but that you need to improve on. However, these parks cost money, and it's going to take time because you have to allocate the funds, you have to gather the money to do so. So it is a work in progress, and it's been identified, So don't feel that this is an area too terribly of concern, because you do have parks and you have places that people can go to commune and be physically active. There are several public and private daycare centers that serve the needs of the community for children and seniors alike. It's important to have these resources set up in place because your community has a large percentage of the working class that commute to work. The main mode of transportation to work is by car at 85%. With this said, that means that you're going to have an increase in air pollution and air quality trends that are slightly higher than average when compared to the rest of the country. There needs to be improvement in your downtown sidewalks. There are very few designated bike lanes. Bus transportation is none. On the outskirts of the city or of the town there are, but not internally to the town. Now to talk about the subsystems of the social system. First, we have family. 79% family households with unmarried partners are at 5.3%. Residents in Mount Airy with income below the poverty level as of February 2014 was at 2% compared to 9.2% of families in America. The median family income in Mount Airy is $99,160, and in Maryland it's $77,042. So as you can see, Mount Airy is a pretty wealthy town in terms of economics. Religion is highly valued in Mount Airy. There are many churches. There's a strong religious faith present, which creates a healthy community. Politically speaking, it's predominantly Republican. That is, as of 2012, 66% Republican and 34% Democrat. A recommended plan to build and shape healthy people in a healthy community by establishing goals and objectives for optimal health and disease prevention is outlined. These goals and objectives were taken in part by Healthy People 2020 and the National Prevention Strategies. You'll see that identified weaknesses through the assessment and diagnosis phase of the nursing process are determined, and 3 prioritized community deficit diagnoses were made. 3 prioritized diagnoses were developed based on the Community Health Assessment of Mount Airy, Maryland. You will see that the first prioritized diagnosis is the actual death among Mount Airy, Maryland residents related to community characteristics of malignant neoplasms and diseases of the heart. The second is ineffective health maintenance among mothers of race, white, non-Hispanic infants born in Frederick and Carroll counties in the state of Maryland. And lastly, transportation safety among Mount Airy, Maryland residents related to environmental and physical impacts of transportation issues. Primary prevention plans for the first diagnosis. Assess factors contributing to the malignant neoplasms and heart disease through risk assessment. 2. Develop guidelines for prevention and intervention strategies from a reputable risk model. 3. Establish education programs from community agencies through ongoing grants and state funding. 4. Grow client access to care and track referrals. 5. Establish health protection activities. 6. Dietary and exercise intervention. 7. Reduce tobacco use and secondhand smoke by legislating smoke-free zones. Primary prevention plans for second diagnosis. First, provide immediate education on nutrition through a simple brochure. Second, provide verbal and written resource of information to guide you community leaders. Third, provide education on fetal development with all newly identified mothers at their initial obstetric visit. Fourth, home visits to provide prenatal classes. Fifth, public media campaigns. Sixth, increase healthcare access to promote widespread healthcare. Primary prevention plans for the third diagnosis. First, provide education over 3 months by presenting PowerPoint presentations on the health implications of the transportation issues to to local board and community groups. 2. Develop a carpool program with incentives to encourage commuters to share rides in order to improve air quality, reduce traffic congestion, and promote safety. 3. Work with local government to develop a plan to create and designate bike lanes in order to promote health. 4. Set up a walking program instead of driving in order to reduce obesity and decrease as measured by participants' BMI. And 5. Solicit volunteer groups to create posters and other media coverage about the new programs to promote awareness of traffic issues. Community health assessment is a valuable tool if you use it and understand it correctly. Thank you for allowing me to present at your town council meeting on my findings that I did in regards to your town of Mount Airy. There are some areas of concern that need attention, but the goal now is to provide this information with the recommended interventions to better provide for your community. Remember, the power of action and determination is needed to provide and sustain your community of Mount Airy, Maryland.